Worldwide, part of the FIP Advocacy Series. It's amazing to see so many colleagues and partners from every corner of the globe joining us today, united by the common mission to empower patients, strengthen health systems, and promote equity in healthcare. Next slide, please. For those of you who don't know me, my name's Madeline Thomas, and I'm the Development Goals Coordinator at FIP, supporting FIP's 21 development goals in their projects. Next slide, please. So some quick announcements as we start this event. The webinar is being recorded and live streamed via YouTube and will also be available on the website fip.org. Please ask as many questions using the question box provided, and you're very welcome to provide feedback on the FIP website. Please also be reminded to become a member of FIP at the membership registration. Next slide, please. So to point you towards the translation features on Zoom, you can turn on captions, enable translations, and choose your preferred language under My Captions. Next slide, please. We'd firstly like to thank our sponsors, Halion, for supporting the production of this online event. Next slide, please. So this 6-part digital series brings together voices from all 6 WHO regions to share practical, innovative, and impactful ways pharmacists are enhancing health literacy in their communities. Over the course of these sessions, we'll explore how our profession is not just responding to health challenges, but proactively transforming the way patients understand and manage their health. Central to today's conversation is FIP's newly launched Insight Report, How Pharmacists Worldwide Are Strengthening Health Literacy and Empowering Patients. The report is more than a collection of data, and it tells the story of pharmacists around the world, from community settings to hospitals, who are helping people understand their medicines, navigate complex health information, and make informed decisions to protect their health. It highlights the systemic barriers that limit our impact, whether that's time pressures, limited resources, or gaps in awareness, and offers actionable strategies to overcome this. As we dive into today's sessions, I invite you to think about the communities you serve, consider the ways that you can apply these insights to empower patients, strengthen your partnerships, and ensure that everybody has access to the knowledge that they need to live healthier lives. Please feel free to engage actively, share your questions, experiences, and ideas. This series is a conversation, and every single voice matters. Today, we celebrate the profession's unique role in advancing health literacy and equity, and highlight what's possible when pharmacists lead with knowledge, compassion, and action. So let's begin. Share and be inspired by how pharmacists worldwide are turning knowledge into action. Next slide, please. Today's learning objectives will help understand key literacy challenges in the Africa region and their impact on equity. Describe and discuss the recent findings of the FIP report on health literacy in the African context. Explore existing training models and professional development opportunities to strengthen pharmacist communication skills, and identify potential strategies for integrating pharmacists into primary healthcare systems to promote culturally relevant, accurate, and accessible information. Next slide, please. So I've welcomed you, and I'll shortly be introducing our speakers, but we'll go through a global and regional overview. There'll be an interactive activity, so please do engage as much as you can. Our call to action, focusing on what you can do post-event, and a Q&A session for any burning questions you have to our speakers. Next slide, please. The FIP development goals are essential to all FIP programmes, and they link programme delivery to the FIP vision and mission via regional and national needs. They underpin all the FIP work to 2030. Development Goal 10, Equity and Equality, is in line with today's webinar topic, health literacy, and is composed of 3 elements. The first, workforce and education, which sets out clear strategies for addressing equity and diversity inequalities in pharmaceutical workforce development, continued education and training, and career progression opportunities. Number 2, the practice element, clear strategies for equity and diversity in pharmaceutical services delivery, service access, and service impact so that all people have access to quality pharmaceutical care. And the third element, science, equity in global capacity of pharmaceutical science training, research infrastructure, development and manufacturing capabilities, and evidence-based regulatory oversight. Next slide, please. And now to introduce our speakers to guide the discussion on strengthening health literacy through pharmacist training and professional development, a focus on Africa. William Mpute is a pharmacist with over 6 years' experience working in different fields in the pharmaceutical sector, namely community pharmacy, hospital pharmacy, and clinical trials. He's passionate about antimicrobial stewardship, rational use of medicines, medicine safety, and quality of medicines and medical supplies. He's an advocate for health equity and health system strengthening and has led 3 projects focusing on capacity building of healthcare workers, health system strengthening, and public awareness campaigns. William works for Akros Research as the Malawi Programme Coordinator for Saving Lives and Livelihoods Project, and is also the President of the Pharmaceutical Society of Malawi, LMIS Country Lead for the Commonwealth Partnership of Antimicrobial Stewardship, and the Commonwealth Partnership Association Fellow. And Refalo Magali is the Executive Director of the Pharmaceutical Society of South Africa, responsible for strategic leadership, support, development, advocacy, and growth across the PSSA membership. She holds a fellowship at the PSSA, has served as the Deputy President of the PSSA, and is a former President of the South African Association of the Hospital and Institutional Pharmacists. She's a registered assessor at the South African Pharmacy Council and is currently serving as a councillor for the PSSA at FIP and the Commonwealth Pharmacists Association. Welcome to you both and thank you for being with us today. Prior to this event, we asked the participants this question, and we should have answers available on screen, and I'll hand over to the speakers to discuss their insights to the responses that were given.
Good afternoon and good evening to everybody. Thank you for joining us this afternoon. Part of the insights that we received from the audience, and thank you for participating, we asked the question, how can ongoing training and professional development among pharmacists improve health literacy across African communities? And we did try to group them according to themes, because a lot of people did respond. So the first theme that we got there was there's ongoing training helps pharmacists to give clear, accurate health advice, improve patient understanding, and fight health misinformation. The second one is that it empowers pharmacists as agents of transformation by encouraging communities through teaching and collaboration. And the third one was it enhances pharmacists' knowledge and communication skills, and also makes them aware of the new trends and practices that will lead to the betterment of the patient. The next slide, please. So I will be taking you through the global overview. Looking at the global view of the survey findings, which reflect responses from 149 pharmacists across different regions of the world. Regarding participation of the pharmacist in public health activities, 72% of pharmacists reported being involved within the past year. The most common areas of involvement were medication safety and adherence, infectious diseases and vaccination, and chronic disease management. If we look at who leads these activities, most campaigns were self-initiated or community-led, followed by those organized through national pharmacy associations like the PSSA and employers or workplaces. This shows that pharmacists are taking initiative at the community level, often without formal structures driving these efforts. However, when it comes to the use of technology, only 28% of pharmacists use digital tools regularly, while 45% use them occasionally and 27% not at all. This highlights an opportunity to strengthen digital integration in health promotion and service delivery. Now, looking at the barriers of pharmacist engagement in public health activities on the right-hand side, the main challenges limiting pharmacist engagement are both structural and motivational. And the top 3 that we will look at today are the lack of incentives or recognition, number 1. Number 2 is the lack of time to participate in campaigns. And the third one is limited institutional or employer support. There were other barriers, which include low public interest, insufficient training in health promotion, and limited awareness of available opportunities. Finally, our findings identified 5 key clusters of support and training needs, and these include tools and resources as one, skills and knowledge development, recognition and accreditation, collaboration and networks, structural and support systems. In summary, while pharmacists globally show a strong willingness to contribute to public health, their impact is often constrained by systemic and resource-related barriers. Strengthening institutional support, incentivizing participation, and expanding training opportunities could significantly enhance their public health and engagement worldwide. Thank you. Next slide. So we will be focusing now on the regional overview in Africa, and I will be handing over to William to take over us on the regional overview. Thank you.
Thank you so much. Global overview. So in Africa, the survey findings were quite interesting. As you can see, 29 pharmacists participated. This is low, as it is only 19% from across 9 countries. So as you can see, like my colleague has said, the reasons that most of them gave include lack of participation in campaigns was 22%, a lack of time to participate in campaigns, lack of incentives or recognition. These incentives doesn't necessarily need to be financial, but just incentives in general, especially on the recognition part, as most of them were doing it on individual basis and self-initiatives. Limited institution employer support. So some of them have to sneak out for them to participate in these campaigns, as their employers could not allow them to do so. Just one of the reasons, lack of public interest or uptake, not aware of such opportunities. Some were very eager to participate in such, but they're not aware if there are any opportunities or any openings for them to participate in that. Insufficient training. Some were eager, saw the opportunity, but they did not have the confidence to step up because they don't have the necessary knowledge. So just to give an example of what pharmacists have been doing across in Malawi, where I proudly come from, pharmacists led initiatives that were like, for example, awareness of HIV prevention and treatment. They also led the distribution of mosquito nets with malaria prevention and education. But like previously said, most were volunteer-based. In Uganda, there was a year-round antimicrobial awareness initiatives with activities intensifying during the World Antimicrobial Awareness Week. So in South Africa, smoking cessation campaigns, including annual TV slots, water health campaigns via TV on health and cold and flu and management. So in all this, it's not hopeless. There are some opportunities that have emanated from the challenges that have been realized. For example, there's a need to provide formal training in communication and skills and health promotion strategies. This will strengthen pharmacists' effectiveness. There's also a need to develop structured CPD programs and trainings and packages. This will be specifically focusing on health literacy. So these are things that we can capitalize on as pharmacists, and also integrate health literacy and public health awareness into undergraduate curriculum, so that when someone is graduating, they are already aware and confident to lead different health promotion campaigns. Next slide, please. So this just brings to get closer the situation that we have previously highlighted on the previous slide. As you can see, the challenges are common among around 22%, and the two ranking up there. And most of them said they have actually participated in health initiatives. For example, 76% said they have participated in the health initiatives. 36% said they joined more than 3, and 45% more than 2, and 18% have only participated in 1 initiative. So it is true that indeed pharmacists are playing a role in their respective countries towards public health initiatives. Next slide, please. And I think I'll hand over to Rifle to continue from there. This is just what I've already said before I hand over to Rifle. Thank you.
Thank you, William. As William has said, in terms of regional overview, we gave some country examples from the interview findings that were taken from the African Pharmaceutical Forum. And for instance, Malawi, they have pharmacy-led HIV awareness campaigns on prevention and treatment, distribution of mosquito nets with malaria prevention and education, and most of them were volunteer-based. And then in Uganda, they had also a year-round antimicrobial resistance awareness initiative, which activities intensifying during the World AMR Awareness Week. In South Africa, we also have smoking cessation campaigns where we participate in annual TV slots. As it is now, it's in October. There is a campaign that is going on now, which is called Stop Sober. It's also talking to smoking cessation campaign. We also have winter health campaigns, which were also presented via TV on flu and cold management, participation of pharmacists in multi-stakeholder initiatives to raise awareness about falsified medicines. We've just signed now an action plan, a multi-stakeholder action plan on falsified medicines, and this is all through participation of pharmacists in these initiatives. Next slide, please. So as I think William did touch on this, there were some challenges and opportunities that we have seen from the interview findings. And these findings revealed key challenges and opportunities to strengthen pharmacists' role in advancing health literacy. Among the challenges, the participants noted that one, there's limited recognition and integration of pharmacists and pharmacist-led initiatives into national health systems and policies. There were also gaps in training and education on health literacy. There's also absence of structured frameworks on training or training modules. Also, I think majorly is the lack of the issue of funding constraints, where most of the initiatives are indirectly funded and we can't sustain them. And I think the fifth one was the limited collaboration within all the allied health professionals, but also the workforce, limited workforce, making it difficult to carry out public health initiatives and balance routine pharmacy duties. We need more people to partner with us and participate. Despite these challenges, though, we've seen that there are clear opportunities for progress, such as providing formal training in communication and health promotion skills to strengthen pharmacist effectiveness, to develop structured CPD programs specifically focused on health literacy and for pharmacists. Also, to integrate health literacy and public health awareness into the undergrad pharmacy curricula. So we've seen those are the opportunities and challenges, but overall, these findings suggest that pharmacists in Africa are ready and are eager to contribute to public health, but to also unlock this full potential or their full potential, we must invest in training, institutional recognition, and system-level collaboration. Next slide, please, and I'm handing over to William. Okay, that's me. Sorry about that. So we've have some questions, and we hope that you'll be able to scan the QR code there, that you can be able to answer those questions. I will start from my side. To discuss what should be the priority action to improve health literacy. Personally, I think in South Africa, I think that one is to make sure that we position pharmacists, we position them as frontline health literacy champions by embedding clear communication, patient education, and community engagement into everyday pharmacy practice. And this we can only do where pharmacists, we know that they are often the first and most frequent point of contact. So the focus areas, I think what we need to do there is to standardize health communication in pharmacy practice, by training pharmacists and pharmacy support in plain language, counseling and visual teaching aids for diverse literacy levels. The second focus area, I think, in terms of action, we need to integrate health literacy into pharmacy education and CPD, where we include health literacy, cultural competence, and communication skills in undergraduate curricula. We also need to participate or maybe start up community-based health literacy initiatives using pharmacies as community education hubs to public health campaigns such as chronic disease management, vaccine literacy, antibiotic stewardship. I think one other thing that we can do as part of our action is to make sure that we leverage technology for accessible information, whereby we can develop and promote digital tools, send text reminders of our phones, and maybe have social media campaigns that will be able to convey reliable and easy to understand medicine information. And I think from our side as professional association like the PSSA, we can advocate health literacy together with academic institutions where we advocate for a national framework recognizing pharmacist role in health literacy improvement. And I think the outcomes for this action, priority action, would be one, improved patient understanding of medicines and treatment plans to increase adherence of patients and maybe reduce medication errors as well. Again, I think the major benefit would be there would be a stronger trust between pharmacists and communities. Yeah, thank you. I think let's go to the next slide. I hope that you did scan the code and we would love to see what you think should be the priority actions. I'll hand over to William for the second question. Thank you.
Thank you so much, Liflo and participants for responding to the question. So the second one is how should pharmacists collaborate with other stakeholders to improve health literacy? So please scan the code so that we can hear your views on that. So I think I'll start by sharing my insights on the same as well. So I think I'll start at an individual level to say that as pharmacists, we need to publish or show out what we can do, because most stakeholders don't know what we are good at. I'll give you an example. This is Breast Cancer Awareness Month. One of the pharmacists in Malawi has partnered with a local gym, and they are raising awareness about the law of being active exercise and the prevention of breast cancer. But this came through because this pharmacist was continually sharing lessons about what they can do. Another one is publication of the work. As Malawi, we published work on antimicrobial stewardship, like pharmacist-led antimicrobial stewardship project. That led to a certain organization in Malawi, Malawi River Outcome Trust, to partner with us so that we can raise awareness on the radio program, because now they understood that pharmacists are capable of raising awareness or playing a different role in the public health space. And as professional bodies, I think we have to be always on the lookout. Those that are representing the Nation Pharmacy Associations, we have to be on the lookout on what are the things that are prevalent in our country and what is the ministry policy direction saying. For example, here in Malawi, we'll be focusing on NCDs as one of the diseases that are rising in Malawi, because we used to be an infectious disease based. We are still like that, but NCDs are also on the rise. And we are partnered with an international organization to raise awareness on the same. So these are the things that we can explore, including the things that the inputs that are being coming from the group. But as pharmacists, we have to be proactive. Let our communities, let our other stakeholders know that we provide solutions, and also let us learn from other stakeholders. Let's be on the lookout. Which stakeholder is interested in which subject, and how can we come in? Recently, we have been looking for stakeholders that are interested in, for example, SFM, substandard and phosphide medicines, and we're looking actively. So just to add from what, as you can see on your screen, from what the members have said, like They must get support to reach a wider population, communicate with other stakeholders is key. We have also to resonate with the public. We have to co-design how we do our things. We have also to consider the cultural setups. We are in Africa, so we cannot rule out how rich Africa is in terms of culture and how it can act as a stumbling block, or also how it can act as a catalyst to spread the messages or to hinder the spread of the messages. So thank you so much for all those responses. If there's no any other more responses, I'll hand it over back to my colleague to take us to the third question. Thank you.
Thank you, William. Please try and answer this one as well. We value your input. I think in terms of what strategies can pharmacists implement to make health information more inclusive and accessible, from my side, my insights that I would love to share is one strategy is if we use a plain multilingual, and I'm saying multilingual because in South Africa we have 11 official languages, so we have to be multilingual, unfortunately. So you use plain and multilingual language, but the language should also be culturally sensitive communication, so that we'll be able to translate key health and medicine information into the local languages commonly spoken in the community. And also maybe try and replace some of the technical medical jargon with simple everyday words and visual aids. That's very, very important. I think a second strategy that we can employ is to adopt a universal design and health literacy principles. For instance, if we assume that everyone benefits from clearer communication, regardless of their education level. We need to use large fonts, pictograms on labels and posters, because some people, when the literacy levels are at a lower level, so they understand pictograms and pictures much better than words. Some other information should be in multiple formats, like in terms of print or verbal explanation, or even audio and digital. I've seen what South Africa, the development now is to include Braille now for the blind people. So when you have you receive a pack of medicines, it also has some Braille signs there. So the blind people can read, using the Braille on the medicines. So those are the things that we need to develop as part of health literacy. I think the third strategy would be to strengthen the pharmacist-patient communication. We should go back to what does it mean to being a community pharmacist, you're saving the community. The trust between pharmacist and patient should be reignited. So, and we also need to encourage a teach back. We currently have in South Africa what we call an ideal clinic. So when we do an assessment and we focus on patient education, you give patient advice on how to take their medicines, but the patient, they have to repeat it back to you so that they understand. So that's what I mean by teaching back methods, where patients will ask you back and explain what they understood in terms of what advice you gave them. We should maybe also allow more time for counseling for complex regimens or chronic conditions. That is why in South Africa, each and every pharmacy is supposed to be by law to have a private consultation area where you can have a one-on-one in a private discussion with the patient, so that other people, will not be participating in that or understand what you're saying, but we give the patient privacy to explain how to take their medicines. I think that's part of creating accessible and physical environments for patients. Like the physical pharmacy layout allows, for people who have disabilities, mobility challenges, to access and get also the same health literacy as those who are not disabled. We should also use digital tools such as your, QR codes and on packaging to link, voice explanations in local languages. I think, again, yes, I'm now talking about pharmacy, but we need to also engage communities as well. Partner with community health workers, your NGOs and your schools as well. During pharmacy month in South Africa, that's the whole month of September, our pharmacists visit schools to extend health literacy beyond pharmacy counters. So that's also part of engaging communities, host health awareness days interactive education sessions on common conditions and safe medicine use. We've done that when we explain to patients on how to dispose of expired medicines. So there's kind of a lot of things that we can, that we can employ, as pharmacists to improve health literacy. Invite feedback from the patients to ensure that whatever materials you're using, they are relevant and they're understandable. I think, also review and update, those posters that you have or the method that you're using must review and update based on the feedback that you get from the colleagues, from other health professionals, from the patients, from the communities. And I think at the end, we're going to win by having better understanding of medicine use, reduce medication errors, greater trust between pharmacists and patients. Thank you very much. I've seen your answers as well. Engage quiet consulting rooms. I think I said that. To also focus on the rural areas, target areas, involve stakeholders. All stakeholders need to participate. They have different roles that they can play in employing the strategies. Dissemination of information. Thank you for that. Community outreach days. Go to the communities, teach them about medicines, how they work, and how they should also contribute and provide feedback. But thank you so much for your feedback, and we appreciate that. The next slide, please. Hand over to William. Thank you.
Thank you so much, and thank you so much for being for the engagement. So I want each one of us to take a moment and focus on this slide. Take a moment and focus on this slide. This is a call for action. Focus on Africa. Our campaign continues beyond this event. It starts with raising awareness. So we're asking each one of you to share this event's recording. The recordings will be sent to you and join the movement on FYP, LinkedIn, and Facebook channels. So Pharmacy in Action, advancing health literacy and equity in Africa. The Legion action lists. So there are 3 you should remember: pharmacist training and professional development. Join or create local health literacy trainings. So like as presenters we have said, and also like members have presented, you can join or create a health literacy training. We have so many platforms that you can participate in the digital space. It's much more easy. Share tools and insights with pharmacy colleagues. I'm sure most of us are on different platforms, so you can leverage on the same to share tools and insights with pharmacy colleagues. Lead a small community awareness activity, like examples that we have been given from across the continent. So I will repeat, our campaign continues beyond this event. It starts with raising awareness. Share this event's recording and join the movement on FYP's LinkedIn, X, and Facebook. Call for action. It doesn't end until we do something about it. Next slide, please. And I'll hand it over to Medley. Questions? Yeah.
Thank you very much to the speakers there for sharing your insights. I have one question for you for this Q&A. To all the participants, please do put your questions into the chat box. So a question to the speakers: how do you envision the role of pharmacists evolving in the next 5 to 10 years with regards to the health literacy and community health promotion? I'm open to either of you to answer this one. Oh, I think I've lost William and Refalo there.
So I think I can tackle it first, and Refri can pick it up from there. So from the different engagements, from the what FYP is doing and what individual pharmacists can do, we feel like in the next 5 to 10 years, I feel like pharmacists will be in a position to tackle, more pharmacists will be in a position to handle evolving needs, health needs at that particular moment. But that can only happen if we take strategic actions towards that. Like we have said, there's need to integrate this at undergraduate level. There's need to have structured CPDs on the same, and there's need to have different materials or trainings that we can keep on updating. The world around us is changing. The problems that we have today will not be the same in the future, will be worse. And we need to continue evolving also as pharmacy professionals, and we need to do something about this. So if we take the right steps based on the strategic direction that has been offered to us by FYP, and if we embrace that and move towards in that direction, we may likely be in a position where we are better off in this space as compared to where we are today. So I'll hand over to my colleague to share more insights on the same. Thank you.
Thank you, Madeleine, and thank you, William. I think in the near future, when it comes to health literacy, pharmacists will be seen now from being dispensers to health literacy advocates. We are increasingly moving away from the counter now into becoming educators, into becoming advocates, into becoming I think people trust us, so they trust us in terms of interpreting their medical information and health information. So that is one thing that we will be moving away from being just the dispensers, but to health literacy advocates. One other thing is we'll be moving from, I think we'll be more focusing on primary health care. When you include health literacy in the beginning, you're starting with primary health care. So instead of our patients going now into tertiary or secondary thing, we will be looking at preventative measures by becoming health literacy advocates. And I think the important part that is in a collaboration with other health professionals. This thing of working in silos as pharmacists, if we work with other health professionals, we'll be able to manage patients holistically, and providing them with information. Patients, when they come to the hospitals with hypertension, for instance, or clinics, they are sent to a dietitian who's going to advise them, on the food that they need to eat, on the doctor, on the medicine. But we as pharmacists will also participate in that by giving them proper ways of taking their taking a proper way of taking their medicines. And I think most importantly, what we're seeing coming now, AI or technology is coming. We no need to be afraid of technology now. We need to be able to embrace technology in engaging our patients and in managing, in talking to them or informing them on medicines, on how to use them. So I think, as pharmacists, we are at a better position to take up health literacy moving forward. Thank you.
Thank you very much to both of you there. We have a question in the Q&A box from Sarah. So what are your thoughts on the advancement of AI in terms of pharmacist roles in improving health literacy, both globally and in Africa? And I think, Raffaello, you touched on it there about the digital side of it, if you want to go first.
Yeah, I think, like I said, we need to embrace it. There's quite a few tools that are being developed now that we need to embrace them and start using them. But I also think that in using them, we also need to be sensitive to that some other communities do not have access to, to advanced technology, so they might not even understand how to use it. But I think part of literacy is teaching them on how to embrace them. I can give you an example. Some of the hospitals, they've developed an app where it's for queue management at the hospital, queue management. So the patient, what they do is they book an appointment to come to the hospital via the app, and it's done by pharmacist. It's in the pharmacy. So instead of going to the pharmacy and standing in a queue, you already have your appointment. You get there at 11 o'clock, which is your appointment time. You're already there. But that is also used by people in the rural areas. They're not even afraid of using it. So I think technology is here, and we must really embrace it and develop as many apps. But importantly, system integration. We can't be having one app there and one app there and one app there. It doesn't make sense. So I think, with technology and AI, you need to embrace it, but use it in accordance and that we don't break confidentiality of patients. Thank you.
Amazing. Thank you very much, Raffaello. William, over to you. You're still on mute, sorry.
Right. So I like how she has explained about the need to embrace technology and also integration, because it's very important that system as pharmacists worldwide and also in Africa, we must embrace AI is here to stay, and we must make the most out of it. But I think for us, it poses a different challenge altogether, because it means that in our setting, for example, in urban settings, we'll have patients that will be coming in. They have already searched on AI what are their diseases, what they're coming towards. So it means that we need to be at our level base. We can have apps that can help us maybe connect different reference materials so that we also help patients quicker. Another challenge is that we still have so much of our population in rural areas where now we still, even when we have the systems, they may not have the necessary infrastructure for us to use that. So I think it's just for us to create a balance between embracing the technology, but at the same time not be completely detached from the community that we serve in, to say that, okay, can this system be applied in this setting, or this one cannot be applied here? But I feel like the coming in of AI is an advantage for us moving forward in as far as the professional development is concerned. Thank you.
That's great. Thank you so much to you both. I think that is all the questions that we have in the Q&A for the moment. So if we can head back to the slides. Thank you very much. So as we close today's session, I'd like to extend our thanks to the speakers for their valuable insights, to the FIP team for all their work in making this series possible, and to the audience for all your engagements and contributions as well. So let's carry forward this inspiration and learning that we've shared today and continue to champion health literacy. Together, we can all strengthen the health of communities worldwide, and we hope you can join us for the next event on the 31st of October, focusing on the Americas region. Next slide, please. A reminder again towards our call to action. And please use this QR code to share your comments after the event, and we'll leave it on the screen just for a few seconds. Thank you, Isa. Next slide, please. So please go to the events.fip.org website to check out all future FIP digital events here, especially this Health, Literacy and Equity series. Next slide, please. A reminder as well about the 84th FIP World Congress of Pharmacy and Pharmaceutical Sciences. This will be held in Montreal, Canada from the 30th of August to the 2nd of September next year. Next slide, please. And please note down these important dates for other events with FIP. Next slide, please. So thank you all again for attending, and thank you for all your contributions. I hope everybody has a great day.